5 health checkups that may harm you more than help. After 70. Let me ask you something personal. Have you ever been told you need more tests, more scans, more checkups, just to be safe? Maybe a well-meaning doctor recommended a bone scan, a heart stress test, or a full-body CT, even if you felt fine. It sounds like good medicine, right? But what if I told you that after age 70, some of these routine checkups could quietly do more harm than good? You see, not every test is harmless. In fact, some can lead you down a dangerous path, triggering unnecessary surgeries, causing kidney strain, leading to cognitive side effects, even increasing your risk of cancer from radiation exposure. This isn't fear-mongering. It's the hidden truth that too few seniors are ever told. Today, we're revealing 5 health checkups you should avoid after 70, tests that are often outdated, misused, or potentially harmful when not absolutely necessary. On screen, you'll see real statistics showing that over 37% of medical tests in seniors lead to complications or overtreatment. We'll also show you safer alternatives that many doctors use quietly, but rarely explain unless you ask. So stay with me, because what you learn today could protect your independence, your peace of mind, and your health. It might even save your life. And before we dive in, please take a moment to comment below. Tell us your age, where you're from, and whether you've ever had a medical test you later regretted. Your story may help someone else avoid a painful mistake. We're reading every single comment. Checkup 5, Bone Density Scan DEXA. Number 5 on our list is the bone density scan, also known as the DEXA scan. At first glance, it seems harmless. There's no poking, no pain, no needles. Just a quick, silent scan that gives you a number telling you how strong or weak your bones are. But here's the hidden truth. After the age of 70, this test may cause more harm than good. Let me introduce you to Rose. She's 76 years old. She loves playing piano and gardening. At her annual checkup, her doctor casually suggested a bone scan. The result? A diagnosis of osteopenia, mild bone thinning, which is completely normal in seniors. Still, her doctor prescribed bisphosphonates, strong bone drugs, just in case. Within months, Rose developed severe acid reflux and something far worse, jaw necrosis, a rare but devastating side effect where the jawbone begins to decay. All from a pill she didn't truly need. What happened? The truth is, most older adults will show some bone loss on a scan. That's aging, not disease. But instead of looking at lifestyle factors like activity and nutrition, doctors often reach for medication first. And here's the kicker. A major study found that bisphosphonates reduced fracture risk in seniors by just 0.3%. That's right, less than 1/3 of 1%. Meanwhile, the side effects include broken thigh bones, esophageal ulcers, and even jaw deterioration like Rose experienced. Now imagine this. What if, instead of pills, Rose had been encouraged to use resistance bands, walk daily, eat calcium-rich foods like sardines and leafy greens, and get more vitamin D? She could have strengthened her bones naturally, without risking her smile, her stomach, or her freedom. So here's the bottom line. If you're not falling or breaking bones and you're staying active, your habits may matter far more than your scan. Don't let a number on a paper scare you into drugs you don't need. Let your daily choices, not your DEXA scan, be your true guide to bone health. Checkup 4, Brain MRI for memory loss. Number 4 on the list, the brain MRI, especially for memory concerns. Now, let's be honest. If you're over 70 and you've ever misplaced your keys, repeated a story, or walked into a room and forgotten why, that little voice in your head starts to whisper, "Is this dementia?" It's a terrifying thought. And for many seniors, that fear leads to one thing, a brain scan. But here's the truth: your doctor may not mention a brain MRI rarely provides helpful answers, and it can often do more harm than good. Let's take George, age 74. A retired accountant. Still sharp, still social, but lately a little forgetful. His daughter suggested a brain scan just to be sure. The MRI showed something called white matter hyperintensities, tiny bright spots in his brain tissue. Now here's the thing. These spots are extremely common after 70. In fact, the majority of older adults will have some degree of white matter changes or brain shrinkage. It's part of normal aging, not always a sign of Alzheimer's or cognitive decline. But George didn't know that. He saw the report, saw the word changes, and immediately panicked. He stopped driving. He withdrew from his church group. He became anxious, depressed, even though his memory was still perfectly functional. In George's case, the MRI caused more psychological damage than any real disease ever could. Eventually, we stepped in. Instead of more scans, we used a simple cognitive screening, just pen and paper tasks to test his memory, attention, and language. No radiation. No contrast dye. No fear. The result? George passed with flying colors. His problem wasn't his brain, it was anxiety caused by a misunderstood test. Here's the takeaway. If you're worried about memory, start small. Try a basic memory screening first. Make sure you're well hydrated. Check your sleep quality. Engage in brain-stimulating activities like puzzles or conversation. In most cases, these gentle first steps will give you a far better picture of your true brain health, without the risk of unnecessary scans or spiraling fear. Because sometimes it's not the brain scan that saves you. It's what you choose not to do that protects your peace of mind. Checkup 3, Cardiac Stress Test. Coming in at number 3, the cardiac stress test. Now, this test might sound like a smart precaution, especially if you're feeling a little more tired than usual or you've had a few off days. But here's the problem. If you're over 70 and not experiencing classic heart symptoms, a cardiac stress test may actually cause more harm than good. Why? Because in seniors, this test has a high false positive rate, up to 40%, according to cardiology studies. That means nearly half the time, the test suggests there's a heart problem when there really isn't one. Let me tell you about Raymond. He's a 75-year-old retired postman who still walks every day. One afternoon he told his doctor he'd been feeling tired walking uphill. No chest pain, no shortness of breath, just mild fatigue. Just to be safe, his doctor scheduled a stress test. The results were unclear. That led to a catheterization, where a tube is inserted into the arteries to check for blockages. They found a mild narrowing and placed a stent, even though there were no severe symptoms. The next day, Raymond developed complications from the contrast dye used during the procedure. His kidneys reacted poorly, and he ended up spending 6 days in the hospital. The worst part? His fatigue didn't improve, because the real cause was simple: mild dehydration and overexertion, not a blocked artery. Sadly, Raymond's story isn't rare. A major study published in JAMA Cardiology found that over 50% of stents placed in seniors after stress test referrals provided no improvement in survival or quality of life. What they did lead to, however, were higher rates of complications, like internal bleeding, kidney injury, and longer hospital stays. So here's the takeaway. Unless you're experiencing classic cardiac symptoms, like chest pain during physical activity, shortness of breath on exertion, or a sudden drop in stamina during light movement, skip the treadmill. Instead, ask your doctor about safer, lower-risk alternatives, like a resting EKG, which checks your heart rhythm while you're still, or a coronary calcium scan, which uses a low-dose CT to look for plaque buildup in the arteries. These tests are often just as informative and far less likely to set off a chain of unnecessary, and sometimes harmful, interventions. Remember, sometimes doing less is the smartest heart decision you can make. Checkup 2, Colonoscopy after 70. Number 2 is going to surprise many people. It's the colonoscopy. Now don't get me wrong, colonoscopy can absolutely save lives. But here's the part no one tells you. After age 70, the risks may outweigh the benefits. And after 75, routine screening often does more harm than good. Let me give you an example. Meet Dana. She's 73. Healthy, active, walks every day, no family history of colon cancer. But at her annual checkup, her doctor insisted she repeat her colonoscopy. She had one 10 years earlier, clean. No problems. Still, they pushed. So she went ahead with it, and that's when the trouble started. The bowel prep made her dizzy and dehydrated. Then during the procedure, they found a tiny polyp, benign. But the removal caused a small perforation in her colon. Result? She ended up in the emergency room, then hospitalized for 9 days recovering from a complication she never should have risked in the first place. And sadly, this isn't rare. A major study published in JAMA Internal Medicine found that for every 1,000 colonoscopies performed in seniors, only 2 lives are saved, but 20 people suffer serious complications. That includes internal bleeding, perforated bowel, heart rhythm issues from anesthesia. So here's what I recommend. If you're over 70 and you've had a clean colonoscopy in the past, and you have no new symptoms, like unexplained weight loss, bleeding, or changes in bowel habits, then don't repeat the colonoscopy. Instead, ask for a FIT test or stool-based test done right at home. These are non-invasive, painless, and almost just as effective at spotting red flags. Remember, in medicine, more isn't always better. Smarter is better. Checkup 1, Annual Full-Body CT Scan. And now, number 1. The most dangerous checkup scenarios are being sold. The Annual Full-Body CT Scan. You've seen the ads. They'll scan your brain, lungs, heart, liver, kidneys, all in under 30 minutes. It sounds like a miracle. But here's the truth, it's more marketing than medicine. Let's meet Fred. He's 78. No symptoms. Just curious. He saw an ad offering a peace of mind body scan for $699. So he went in. They found suspicious spots on his lungs and liver. He was terrified. Next came a lung biopsy, which caused bleeding. Then an MRI. Then a liver biopsy. 3 weeks of tests. 3 weeks of anxiety. And you know what they found? Nothing dangerous. Just normal, age-related changes. Things that never would have mattered. But the fear? The procedures? The risks? All that was real. Here's what the science says. CT scans expose you to significant radiation. 1 full body scan equals hundreds of chest X-rays. And in older adults, they often find incidentalomas, non-dangerous abnormalities that lead to invasive follow-up. Harvard researchers call it the cascade effect. 1 harmless scan leads to a whole cascade of costly, risky interventions. So what should you do instead? First, don't scan what isn't broken. If you feel fine, no symptoms, skip the full-body scan. Second, focus on targeted, low-risk screenings with real evidence behind them. For example, blood pressure monitoring, glucose and A1C for diabetes, cholesterol and triglyceride panels, simple skin checks for moles or growths. These tests actually improve longevity without the radiation and risk. Bottom line? If a scan is advertised as comprehensive, preventive, or peace of mind, ask, who benefits? You or the clinic's bottom line? Let's take a moment to recap what we've learned today. First, bone density scans, while sounding harmless, often cause more fear than actual help, leading many seniors to unnecessary medications with serious side effects. Next, brain MRIs for mild memory concerns frequently trigger panic and lead to invasive tests that rarely improve outcomes. Then, the cardiac stress test, a common culprit in seniors, may result in needless stent placements, carrying risks without improving survival or quality of life. We also covered the colonoscopy, which can be risky for those over 70 without new symptoms, with harsh preparation and a higher chance of complications. And finally, the full-body CT scan, a test that exposes seniors to significant radiation without proven benefit, often causing a cascade of expensive and risky follow-ups. On your screen, you'll see a simple guide. Green checkmarks next to smarter, safer tests like cognitive screening, fit stool tests, calcium scans, and lifestyle choices, while red crosses mark the tests seniors should avoid or question after 70. Remember, real prevention isn't about more testing. It's about smarter testing. So, when your doctor recommends a test, don't be afraid to ask. What happens if this test finds something? What are the risks of follow-up procedures? Is this test truly necessary at my age and health status? Your health, time, and peace of mind are too valuable to waste on fear-driven screening. Before we finish, we want to hear from you. Have you or someone you love ever faced complications from a medical test you later regretted? Please share your story in the comments below. Your experience might help others avoid similar pitfalls. And if you found this video helpful, please give it a like and subscribe to our channel for more trusted senior health tips. After 70, your greatest defense isn't technology, it's wisdom. Stay smart, stay strong, and stay well.